Hi, Miss Berry. My name is Bailey, and I'm going to be your occupational therapist today. First, I just want to ask you, do you know what your name is?
Halle Berry.
Okay, and do you know where you are?
On the hospital.
Okay, and do you know what day it is today?
No.
Okay. Holly, do you know why you're here today?
No.
Okay, so you experienced a stroke on the left side, so it's affecting your right side. You may have some troubles moving your right side and going in these different ranges of motions. So as an occupational therapist, I am here to help you be able to move more functionally throughout your day and with your different tasks. So for example, dressing and brushing your teeth, brushing your hair. And I also saw that you were a mother, so being able to go out with your kids and being able to do different activities with them.
Okay.
Any questions?
Not yet.
Okay. So I just have a few questions here because I want to get to know you a little better, okay? So first I want to ask you, do you live by yourself or do you live with other people?
My partner.
Your partner? Okay. And do your kids live with you also? Do you have kids?
2 kids.
2 kids, okay. And do you know how old they are?
11 and 7.
Okay. And do you know what your house is? Like, is it a 3-story, a 2-story, a 1-story home?
3-story.
3-story, okay. And do you know how many stairs there are going into your house?
No.
Okay. Do you know how many stairs are inside your house at all?
No.
Okay. And then, is your bedroom and bathroom on the main floor, or are they on a different floor?
Main floor.
Main floor, and is that where you stay?
Yeah.
Okay. And for your bathroom, do you have like a walk-in shower or no walk-in shower? Do you have like a tub and a shower?
Walk-in.
A walk-in, okay. And at your home, do you have any DME? This is what we call durable medical equipment. So this would be like a front-wheeled walker, a cane, a wheelchair, anything like that.
I don't think so.
Okay. How about any adaptive equipment? This would be like a reacher, some grab bars, a socket. Do you have anything like that?
No.
Okay. And then driving around before your stroke, did you do that by yourself or did you have someone else drive you?
I drove.
You drove? Okay. So have you ever fallen before?
No.
Okay. And then do you have any family that lives close by?
My sister.
Your sister? Okay. And does she live close to you or kind of far away?
Close.
Close, okay. And when you go home, would she be willing to come and help you out at home, or?
I hope so.
Okay. And then what did you do for a living?
I acted.
Acted? Oh. And was that full-time, part-time?
Full-time.
Full-time? Do you get to hang out with your kids a lot while doing that, or is that kind of hard?
It's kind of hard.
Yeah. Are they pretty busy?
Yeah.
Yeah. Do they play any sports at all?
Yeah.
Yeah. What sports?
Football.
Nice. Yeah, my brothers played football when I was little, so we would always go to their games. It was fun.
Yeah.
Okay. Now I just want to know how you were doing your activities before your stroke, okay? So with your dressing and getting ready in the morning, did you do that by yourself, or did you have other people help you?
I did it.
You did it? Okay.
Yeah.
And what about, like, toileting and showering?
Yeah, I could do that.
Independently?
Mm-hmm.
Okay. How about with feeding? Were you able to feed yourself? Okay. And then how about cleaning the house, like dusting, sweeping? Did you do that, or did you have someone else do it?
I did that.
You did it? Okay. How about laundry?
Mm-hmm.
Okay. And then, did you have any medications that you were taking prior to this? And if so, were you able to manage those?
No medications.
Okay. And then, are you in charge of your finances, or was your partner in charge of them?
My
Partner, okay. How about meal prepping? Were you in charge of meal prepping, or
Mm-hmm.
do you like to cook?
Yeah.
Yeah.
Mm-hmm.
What's your favorite thing to cook?
Mac and cheese.
Mac and cheese. That's always good. So are you experiencing any pain right now?
Yeah, a little bit.
A little bit. So on a scale of 1 to 10, 1 being no pain and 10 being absolute pain, what would you rate it as?
4.
Okay.
Probably.
A 4. Okay.
Yeah.
And can you explain where you're experiencing at?
Kind of all over.
All over? Okay. And what kind of pain is it? Is it like a throbbing pain, a tingling pain? How would you describe it?
Dull.
A dull? Okay. Okay. So now that I've kind of gotten to know you a little better, I kind of want to see how you are moving with your right extremity and just kind of getting a feel of where you're at right now, okay?
Okay.
So first what I'm going to start off with is working on your scapula. I just want to see if it glides nicely while you're laying here in bed, okay?
Okay.
So I'm going to move the camera. I would never leave my patient, but just so that you guys get a better thing. Okay, so first what I'm going to do is I'm going to place my hand on your inferior medial scapula, so right here. Do you feel my hand there?
Mm-hmm.
Okay. Then I'm just going to support your elbow right here, and if you want, you can grab onto my arm if you can do that.
Okay.
And I'm going to do elevation and depression, so I'm going to move your scapula up and down, okay? Okay, so while we're doing this, is there anything that you want to be able to do after therapy?
Just really spend time with my family.
Okay. Sounds,
Work.
Yeah, want to get back to working?
Yeah.
Okay. So next what I'm going to do is protraction and retraction. So what I'm going to do is I'm going to push your forward, back, and just kind of move it. See how it's working here. Okay, so next I'm going to do upward rotation and downward rotation. So I'm going to make sure that your thumb is pointed up so that way it's not in supination, pronation. So, and then I'm going to grab your elbows and we're going to go up and down, up and down, up and down. Okay. That all felt good. It felt like your scapula was gliding really nicely. So now what we're going to do is I'm going to roll you to the edge of bed, and then we're going to sit up, okay?
Okay.
So I'm just going to move that out of the way. Are you able to lift this hand? Okay. And then are you able to reach over and grab your arm at all?
Yeah.
Okay, and then can you lift it onto your stomach for me? Okay, perfect. So I just want it up just a little bit more. So I'm doing this to be able to protect your right arm, because while we're rolling, I don't want you to lose sight of where it's at, and I don't want it to get stuck while you're rolling and cause more pain for you, okay?
Okay.
So now what I'm going to do is I'm going to put my hand on your hip and your shoulder. On my count of 3, we're going to roll over, okay?
Okay.
Okay. 1, 2, 3. Okay, now I'm going to set your feet onto the side of the bed here. And then I'm going to put my arm here. And on the count of 3, we're going to sit up. 1, 2, 3. Perfect. Do you feel dizzy at all?
No.
No? Okay. Okay. I'm going to move my camera again so that way you can see. I wouldn't leave my patient alone otherwise. Okay. Do you feel lightheaded or anything?
No.
Okay. So I see that you're tilting to your right a little bit. So what I want to do is I want to keep you in good alignment here. And also I'm going to scoot you so that your feet are touching the floor. Okay? So we're going to go right, left, And I see that you are wearing socks, and they are gripper socks, which is good because if you're not wearing socks, you potentially have is a fall risk, and we want to be able to make sure that it is for your safety to be wearing either gripper socks or shoes.
Okay.
Okay. So I want to make sure that you are in good alignment. Is it okay if I get behind you and kind of straighten you out a little bit? Okay. So what I'm gonna do is I'm gonna tilt you forward and then put my knee here and sit up just like that. Does that feel okay?
Better, yeah.
Okay. So now what I'm gonna do is I'm gonna put this gate belt on you. It's just for safety, so that when I am transferring you to the chair, I have something to hold on to. Do you have any questions so far?
Is my arm okay?
Yes, your arm is good. I like how you are holding it and making sure that it isn't going to the side and letting gravity take over, and you're staying in good posture. Okay, I'm just going to tuck that so it's not in the way. Next, what I want to do is I want to see your range of motion, so I'm just going to have you copy what I do.
Okay.
Because I just want to see, because while you're doing different activities, you have to be able to get into those ranges, so I just want to see how you are with those. So are you able to go up? Okay, and down. You able to go out? Okay. You able to go behind your back at all? Okay, how about behind your head? Okay. Are you able to bend your elbows? Okay, and down. Are you able to move your wrist? Okay, and are you able to go back and forth? Okay, and touching your fingers. Okay. Perfect. Okay, so now what we're going to do is I'm going to stand you up, so just so that I can get a better understanding of how you are standing, okay? And then we'll sit right back down.
Okay.
So while I'm transferring you, I want you to hold your arm, your right arm with your left hand, just like that, and keep it tucked so that way when we do stand up, it's not just dragging you down, okay?
Okay.
Okay, so we're going to stand up on the count of 3, okay?
Okay.
1, 2, 3. Okay, any dizziness at all? Okay, we'll sit back down here.
A little bit, yeah.
A little bit dizzy? Okay.
Just a little unstable.
Okay. I felt that also while transferring you, so now I want to transfer you into the chair, and what we're going to do is what we call a squat pivot. So instead of standing all the way up, it's going to be one fluid motion where we're both going to stay squatted, and I'm going to lift you up a little bit and put you into the chair, okay?
Okay.
Do you have any questions at all before doing that?
I don't think so.
Okay. So, on the count of 3, we're going to pivot into the chair, okay? 1, 2, 3. How did that feel?
Good.
Felt good? Okay. And I see that you are scooting yourself back into the chair, which is good. Do you feel comfortable?
Yeah.
Okay. So now what we're going to do is do some upper body dressing with this jacket. So I just want to see how you do while putting this jacket on. I see that you are also leaning, so do you feel that you are leaning towards that side?
Yeah.
A little bit? Okay, so I just want you to be aware of that and just try to keep your hand on your lap here and to keep into midline just like this.
Okay.
Okay. So now I want you to put this jacket on. So what you're going to do first is you're going to, with your left hand, place your right hand into this side of the jacket. Perfect. And now if you can get it all the way up to your armpit there, and then with that hand, just kind of reach over and, slide your hand to the other side of the collar there. And then getting your other hand in. Perfect. How did that feel?
It was easy.
It was easy?
Mm-hmm.
Good. Okay. So now, do you want to take your jacket off or do you want to keep it on?
Off.
You want to take it off? Okay, so now, so when you are dressing yourself, you always want to remember to put your affected side in first, so that would be your right side. But when undressing, so when taking your jacket off, you're going to want to take it off on your good side. So you're going to start off with your left side here, and yep, wiggle your hand out there, and you can also like try to use your hip, and then reaching over and taking your right side. Good. Nice job. How did that feel?
Good.
Good. So do you have any questions for me at all?
No.
No? Okay. And I see that you are leaning again, so I just want to straighten you out. Now I'm also going to put my pillow underneath your arm here just to help support it and get it into good alignment with your body. So any questions before I leave?
No.
Okay, well, I look forward to working with you and seeing your progress throughout our sessions here. Have a great day.